Join us in welcoming Amy L. Kennedy, the Kennedy Forum, Duncan Young, Effective School Solutions, Katie Dorn, EmpowerU, Gary Alpert, Brightline, Wizdom Powell, Headspace, and Josh Golomb, Hazel Health.
This is great. So back with some more experts in education, but before we get into that, I just wanted to remind everyone that FEMA is doing an alert today on your cell phone. So during this panel, we'll likely have that. Don't be alarmed. Honestly, I feel like I'm saying to the students, right? We do these security drills with the kids at school, except it's much more traumatizing. So everybody can remain in their seats, and we'll get started, and we'll see when that happens. It'll be a fun surprise. In a year when 57% of teen girls reported persistent sadness and 56% of LGBTQ young people who wanted mental health care were not able to get it, the people on this stage are no stranger to the urgency of youth mental health. To start off our discussion, let's get right down to brass tacks with an emergency COVID funding coming to an end. What gaps will be created, and how will we fill those funding gaps to continue providing these essential services? So this is top of mind for everyone on the stage. The funding's changing. Some administrators used it to the max. Some did not use it effectively. But either way, we're going to see a change in the willingness to invest in this. So what can we expect? What are you worried about? Why don't you start us off, Duncan?
Yeah, I think school-based mental health is really at risk of becoming probably the biggest unfunded mandate in kind of the mental health system and in schools and in our education system as well. Many districts use COVID relief funding to make deferred investments that they knew they needed to make for a long time, and they were finally able to do them with the dollars that were available. To me, the mental health crisis obviously is not new. What really changed with COVID was districts fully realizing the power of their potential when it came to being delivery points for really high quality mental health. This is not a nice to have function for schools and for our education system anymore. This is a must have function. Unfortunately, I think policy has not kept up kind of with that. So districts right now are scrambling and really trying to figure out how they fund these programs in a sustainable way. And from a moral and ethical standpoint, if we are really saying as a society, as a system, that mental health is critical, we've got to make sure that there's more consistency. That means this shouldn't be grant funded. I think a lot of the grants are great and well-intentioned, but they're Band-Aid solutions to a much bigger problem. So we really need to look at more set-aside funding that's really targeted towards mental health. It shouldn't be mental health and 18 other things that it can be used for. And we really need to also think how our commercial payers and how Medicaid can really start making it easier to tap into those medical payer pathways for what essentially is a medical service being offered within the education environment.
Yeah, we just heard our New Jersey representative this week say our taxpayers are paying for this twice. They're paying for it twice. Can you maybe tell us, Josh or Gary, some of the states that you see are doing this right, that are looking at how to bridge this gap in their funding? Have you found any examples?
Yeah, well, first, thanks for having me. So I'm Josh, and we're finding a lot of variability. And so the state of Hawaii, a lot of how Hazel got funded initially, which is we do virtual care in schools, was through what's called ESSER funding, so these sort of federal grants. And what we've seen is almost all of our partners are trying to find a way on their own to sort of get it more sustainable. So the state of Hawaii actually put it right into the governor's budget, sort of a line item to keep it sustainable. In Florida, we're seeing our superintendents actually trying to just craft it into their general budget year over year. And thankfully, though, in some of our states, there's actually health plans that are coming to the table saying, we want to be the ones to fund this, because to what Duncan's saying is they know we're seeing their members, and by getting access to care, we're helping them meet their outcomes, but also keep them out of an emergency room or some other high-cost event. California is also very exciting, but Gary, I'll let you talk to that one.
Great. Yeah. So I'm Gary Alpert, and I am with a company called Brightline, which does pediatric behavioral health kids up to the age of 18. So I'm going to try to blend our comments. We can almost all finish each other's sentences these days. But first, as far as California has an initiative called the CYBHI, and if you don't know about it, you should read up on it, the Child and Health Behavioral Health Initiative. It's a $4.7 billion funded program by California, which is funding a number of different programs specifically related to youth mental health. Brightline is going to be involved in one part of that program, which is called Behavioral Health Virtual Services. And as of January, through this program funded completely by the state, we will be providing care to all children under the age of 13 through a combination of a digital platform and coaching, paid for by the state. So this is the innovation, one of the many innovative parts of this program. In many, many states, behavioral health for kids especially runs through Medicaid, which has a lot of hoops and hurdles that you have to jump through. And this is a different kind of approach. Lots of learning, I'm sure, will come from it. We're one of many different vendors that's part of this program, including many others, but it's a program to watch. And the other piece is the question around funding. And I think that all of us know that there's just so much burden on schools, and expecting schools to fix the youth behavioral health program, frankly, is not the way that we're going to address mental health holistically. We all need to be part of it together. And I would specifically call on health plans as one of the funders, main funders of behavioral health, who are stepping up and have an important role to play here. We work with many of them. And then also employers. Employers, obviously 150 million Americans receive their health care through their employer. And we've been talking about, total health care is mental health care and physical health care. So it's absolutely critical that these programs are at the top of the priority list for employers. We just heard earlier from HCA and Bank of America. There are many others where it's on the top of the list. I know, KPMG spoke yesterday. McKinsey is here. All of these companies have identified youth behavioral health as a program they want to invest in specifically. And I'm not talking about just relying on EAPs or some of the traditional mechanisms that we all know do their best for behavioral health, but youth behavioral health is not traditional behavioral health. There are a lot of aspects of treating kids and families which are different than adult behavioral health. So that's kind of where we think about it.
Thank you. Katie, maybe you could speak to this next one. We just heard from Nayo, who was fantastic. Nayo talked a lot about the trauma of the students she's working with, and it also, of course, leads us to all think about what we're reading in regards to teacher burnout and how will teachers who may or may not have been trained in both recognizing the signs or addressing them in their classroom are going to be overwhelmed during this surge. How can we help educators and their students?
I think it's definitely where it needs to start. I loved what Nayo said. It needs to be all points, the community, parents, students, but educators. They're on the front lines. And while solving the mental health crisis cannot be on the backs of teachers, we need to equip them with the self-care and the skills in a supported fashion so they can put the oxygen mask on themselves first. You've read the headlines. We are short teachers. They're leaving the profession at record numbers because post-COVID, what they're dealing with in their classrooms is unprecedented. It's unprecedented. And if we don't, find a way to deliver these skills to them so they can model coping to their students, so they can reconnect with their purpose, so they can understand, why am I here each day? So they can then scaffold from a personal, because we learn from stories. The people who spoke today, who spoke from the heart, that's how we learn. The people who stood up today and said, hey, I was in recovery. I struggled, Nayo's story. That's what touches hearts. So for an educator to just teach, mental health isn't one of those things that you can just teach. My son's a middle school math teacher, and he can just do it over and over again until kids get it. But if you're going to change behavior and impact well-being, You need a teacher that can stand up in front of the classroom and first model that. And then 2, share their stories. Hey, this helped me, it can help you. Vulnerable, transparent. Programs that can really move the needle, that's tier 1 in my book. Tier 1, addressing educator mental health is just paramount to any program success.
Wizdom, do you want to add to that?
I will, and thank you so much, Katie. I mean, I appreciate that. At Headspace, one of the things we realized very imminently during the pandemic especially was that our educators were hitting a wall with their own mental well-being and filling up their own tanks. And we had to work to create resources that would help them give from the overflow. And so we launched a Headspace for Educators program, which provides toolkits to educators that helps them bring mindfulness, which is moment-to-moment awareness, being present, bringing that to classrooms in ways that could speak up to students. But I really appreciate what you said, Katie, about the fact that we're not going to be able to do this work solely on the backs of educators, because the other thing we realize is that we are now expecting our educators to be nurses, counselors, family systems mediators, and Mortal Kombat fighters in some schools, depending on where you are educating. And I think that burden is tremendous, and it doesn't really offer the kinds of whole person solutions that we really need to create healing-centered schools. As a trauma psychologist, one of the things I know for sure is that young people are more than the sum total of the wounds that they've experienced. They need schools and classrooms that speak up to them, that see them whole, and that remind them that they are more, that their efforts to heal, grow, and thrive are more important to us than trying to assign a particular value to how they should be thinking about their emotional and academic performance. What that means is that in a healing-centered school, you are focused on the strengths and assets. One of the things that I've been listening to in this conversation is how often we've been talking about young people as problems to be solved rather than wonders to behold. And in a healing-centered school, you are speaking to the strengths of that student. You're reminding them of who they are, where they're from, and their own capacity to tap into their own power. So even the language that we use around empowering youth is problematic for classrooms because we can't give students their power. They have power. We have to help them tap into it and leverage it so that they can benefit from what is already in them. A strengths-based approach is what's called for, and that's for teachers too, for educators as well.
Wow, that's fantastic. Yeah, that's an applause. That's an applause. That's fantastic. It makes me think, and this isn't on here, but as you're talking, how do educators and we who are in this space walk the political tightrope that we can imagine comes from the work that we're doing, because we've seen so much volatility around what's happening in schools. Yeah. So, as we want to be able to help young people tap into their own strength, yeah, I think that's scary for some people.
Absolutely. I mean, Kwame Appiah, talked about what future generations will condemn us for. Mm-hmm. And I think that our young people are going to condemn us for the apathy that we're coming to this problem with. Like, there's literal fire on the mountain, and I know I'm preaching to the choir here, the converted already, but I think that a broader call to action here around the fierce urgency of paying attention to what young people need in this moment and what that will yield for our democracy is the kind of conversation we need to have. Like, everyone should be afraid of what we're seeing now in our schools. The increasing exposure of our children to gun violence in schools. Regardless of where you sit on the other side of the aisle, on either side of the aisle, you have to know that that's a problem that isn't tenable, and it's not normal. It's not normal to go to school and have to duck under your desk and do gun drills. That's not normal. We shouldn't be sitting with that, with the kind of apathy I think that exists, not in this room, but in others that all of us spend our time in. So I think that call to action, the fierce urgency of now, is where we need to be sort of signaling people and making sure that we're all aligned, as this conference is calling us to the fact that we are all responsible for those young people. Future generations should and will condemn us for this moment where the policy window's open. What will we do with it?
I'll add one thing too. I think the great equalizer as a parent, I don't know how many of you are parents, but when you see your child suffering, and the numbers are now that any of us in this room, like we all have someone. You know, when your child suffers, the family suffers. And the great equalizer is when you have your child in pain, I don't care if you're red or blue or purple, you welcome the help. And I think the numbers are so high that I think that's going to hopefully quell the apathy and light a fire under every parent who wants their child to thrive. That's my hope.
Yeah, I think mental health is the closest thing we have to a bipartisan issue right now, and it's not. And Amy, you and I have talked about like the importance of what we call things, and I see a distinct difference right now between SEL, right, which clearly has been a term that has been politicized in a big way, versus mental health, where I think there is kind of largely consensus, especially from folks' lived experience. Everybody has someone in their life, either themselves or a loved one, a friend, a family member who suffered kind of with a mental health challenge. And I think that gets us out of the acronym bingo game, and it gets us more into the reality of what are the challenges our young people are facing and how do we support them.
Just one piece of data to all of these points. We did some research very early on with parents, just talking about what do you want to see from the pediatric behavioral health program, and what we heard from parents, 75% of parents said, I will put my own mental health needs aside and treat my child first. In fact, it is my child's mental health needs that are contributing to many of mine. So put the kids first is important. The other thing I can't help but look back at what John F. Kennedy said about kids when he was president, and there have been many great quotes that we've talked about here, but I found a good one just around the urgency of now, which is, this was part of the signing of the Maternal and Child Health Bill in 1963. We can say with some assurance that although children may be the victims of fate, they will not be the victims of our neglect.
Still a good one. Still a good one. Let's talk about how we can address some of those challenges then. When we look, Hazel is doing a lot of great work through telehealth. Maybe you could just tell us where that stands now that some of the guidance on that has changed, and why that can be part of the answer for schools.
Yeah, thank you, Amy. And I want to talk also, fold in that equity, because I think one of the questions folks often ask is telehealth and technology, how do we use that to drive out inequities? And a lot of it is actually, when we think about what we see in digital health, is it can either exacerbate or reduce inequities. What you find if you actually look at our school districts, and so about half of, when we look at the primary language in a school, for example, only about 90% of our schools have at least 2 different languages as their primary language. 50% of our schools have 5, and 30% of our schools have 10 different languages that a parent has identified as their primary language. So it's an incredibly diverse group of needs that our kids have. And just by way of background, so our model works that either when we partner with the school district, either a parent can refer in and see we're both the technology platform and the providers, or someone at the school staff can identify a child that may have a need, and then they go into our care. Typically short-term, and for kids that need longer-term care, we connect them to that in the community. And the data has been pretty amazing. So what we're finding is that we are more than doubling the amount of access in a community to mental health services. In our top 10% of schools, we're often getting as many as 15% of kids getting referred in and being able to treat for care. And what's equally exciting is it's a really diverse group. And so 68% of the students that we've seen are Black or Hispanic. And so there's a real opportunity in this. Our school partners, I have more of a healthcare background, and so I'm so humbled, because essentially what I feel like has happened for them, having worked in healthcare, is because we've dropped the ball in a big way on our kids, and the schools are filling the gap. And they are willing to, and it's when we started all this work, there's this question about how much would schools embrace change and what would that look, and I will tell you, those folks will go through walls, will do whatever they need to do for their kids, even though they're not the most tech savvy, they're not the most tech adept, but they are so passionate about solving problems for their kids that it's been fantastic.
That's fantastic. And We know that some students still are going to have disparities when it comes to access to broadband, and where telehealth may not be the answer for them, or what does it look like when it's summer, or when, so how are we solving for that? What's some of the solutions that we can offer up? Duncan, do you want to?
Yeah, so I think part of it goes back, I think, to what our previous speaker mentioned about making sure that we've got broader access in the community. So when summer is taking place, it's not just kind of the school, it's the place of worship, it's the public library, it's other places within the community that you can provide kind of support. We also kind of look at it from an acuity standpoint. So our organization at Effective School Solutions, we provide more high acuity care. So we really support the 2 to 4% of students that have the highest level of mental health need in the school setting. And that generally is a modality of care that is going to tend to be a little bit more in-person, a little bit more wraparound, structured therapeutic touch points, but also the ability to push in to a classroom and pull a student out when they have needs. So I think in figuring out for school districts the right kind of blueprint for what a comprehensive mental health system looks like, it means looking at every single tier of support, tier 1, tier 2, tier 3, and making sure that we've got the right tool in the toolbox to support students relative to their acuity level. And that's a big area that I think districts are struggling with right now, just from an expertise standpoint. Everybody agrees on the framework of multi-tiered systems of support. So every school district has a pyramid, and then they know they should be providing 3 tiers of support. What they don't necessarily know is what does good look like at every single one of those tiers. So really the emergence of a set of state level standards, national standards, to really guide districts in those efforts, I think is really, really critical.
We like standards, we like guides. This is fantastic. We talked to Nayo just a few minutes ago, and I said, when you're dealing with your students, is it training? Is it your gut instinct that maybe something's going on? We know that screening would be a really useful tool. Can we talk a little bit about that? You mentioned tier 1. What could that look like for schools? Do you have any examples of where that's working, that you're already using it in either district-wide or opt-in? I don't know. Who would like to take that?
Yeah, I'd say screening is complicated based on the state, right? We know that in consent, but it's super helpful for districts that, like Duncan talked about, this tiers, right? So if you're doing universal supports and delivering classroom skills, basically, I think we need to normalize that school, although we don't want to put the burden on it, when you talk about equity and access, and how big the problem is, it is a great place to deliver skills. And we have to kind of normalize that, 66% of kids, are struggling with one diagnosis or another. And if we take a skill-based approach, all the money that goes into test prep, if we could take that money and put it into teaching skills that will help students navigate their hard, instead of accommodating and fix it. I'm a licensed school counselor, and when I was in schools, I wrote 504 plans for our tier 2 solutions, and they did nothing. I never saw a student get better suddenly because they had an accommodation. What they needed was skills in a supported fashion, and if we can deliver that at tier 1 to all students, and then use a screener to identify those students at tier 2, get them the skills in a supported fashion so that they don't have higher escalation, because you can't, I don't like the term, but you can't have an inverted triangle. You can't have 30% of your students in Duncan's, services. It's just not going to work, and that isn't sustainable. So intervening early, understanding the different levels, delivering service. There's payback. There is ROI for schools, and then lastly, having data, having outcomes that schools, because they care, let them see. That 90% of the students at tier 2 made progress, and they don't need higher escalation, and that is where the ROI for the investment will continue. They'll fund that. They'll fund that all day long.
That's right. Josh, can you jump in on that about knowing what students need at what point and how long?
Yeah, and this is, as you were saying, this is complicated, because I think a lot of our districts also worried about, if you screen but you don't have the resources, what do you do in that scenario? But I think a lot of our districts are thinking about, could you start to think about this less, even just a terminology, less of a screener and more of can you imagine more of an annual kind of wellness checkup? Which includes, by the way, we find that about almost half of our kids who are on Medicaid will tell us they don't have a PCP. And so just this idea of, can we make this more about general wellness? And it makes it a little bit safer and easier also for our school district to talk about, especially, as you mentioned, there is this whole political realm around social emotional learning. And the more we make this about kind of their general well-being, I think it's easier for our school districts to navigate.
So you mentioned Medicaid services, Medicaid school-based services, schools as a site of service. Some states have already expanded that or made the amendment possible, and yet I think we're still not there. So ideally, what do you see as still needing to happen? Wizdom, do you want to tell us where, like in your vision, where do we need to go?
What?
Oh, here we go.
And there we have it.
You get to think about that for
Right
a
on
minute.
cue.
I did ask how long. They said a minute.
Everyone have your buddy.
Well, that was the alarm to remind us of the fierce urgency of what we're talking about, I think.
Okay.
Right on cue. And back again.
We can tell who has like really good service.
Right.
Who's got Verizon, who has inferior, T-Mobile, who's got this? Well, no. Oy.
Well, I mean, what comes to mind for me, obviously, sitting where I sit now, is both the promise and albeit the pitfalls of digital mental health interventions and the capacity that those approaches have to mine some of the gaps, not all, in our delivery system to young people. And at Headspace, what we're learning as we listen to young people, so the first thing I would say is that look around you, the seats next to you, your right, your left, and behind you, and count the number of young people that are in the room today. Right. So I get that we and I do this all the time for myself because it's not often the intention to not include young people, but we do a lot about young people without young people. And what I say to folks is that we have to have solutions, if they're going to work at all, that are co-designed. We think that if we build it, they will come. But if we build it with them, they'll come. And young people have a lot to say about digital mental health and how they use it. Most of us in this room who are parents or grandparents or aunties or uncles have been around a young person and have observed them always being on their phone. And it happens to be the bee in the bonnet of most of us, right? We're like, get off your phones, connect with me. And what they're saying is that the digital technology is giving me opportunity and a inroad to connect with young people around the world. For some young people, their homes aren't safe spaces. Schools were the safe spaces, right? So digital technology helped those young people who were in unsafe homes have a lifeline outside of those homes. So I think there is a promise to leverage digital mental health technology in ways that can support young people, but we have to do that thoughtfully. We have to have standards. We have to understand what's working, measure the impacts of those interventions. We have to have clinically validated tools and approaches, but I do believe that there's some value in meeting young people where they are. They're connecting in digital space already. And Common Sense Media did a study and showed that many young people were leveraging social media during the pandemic for mental health advice. Can we go to those spaces, not as as owners of the space, right? We have to come as visitors. Adults, we have this way of coming into spaces with young people and talking over them. We have to make sure that when we enter those spaces, we're delivering interventions in those spaces that are delivered in their language. So I'm tremendously excited and hopeful about the potential, but I also think we have to reimagine what that landscape is going to look like. That means that we have to safeguard those spaces in ways. We have to look out for the algorithmic biases as we are taking on machine learning and bringing these resources to schools and to communities. And lastly, what I will say is that we have to think about whole communities. Someone else said that earlier. We have models in this country, accountable communities for health. We also need a similar level of accountability for schools. And this is where the private sector, I think, could play a considerable role by thinking about the power of co-opetition, not competition. How do we come together like the CEO Alliance? How do we come together like the Alignment for Progress in ways that says we're in this together, let's leverage the best of what we have to develop the kinds of solutions that we can deliver to those young people.
And let me build on the co-opetition piece. I think that's going to be really, really important as commercial payers start to get more into this world, because commercial payers are oriented typically around kind of like the single life, the single covered kind of child, the single covered family. School districts generally think in terms of like groups of students. I have a group of students that I need to service. So for us to really harness the power of commercial payers going into the school environment, by definition, we're going to have that co-opetition, because if you go to New Jersey, where we're based, you probably have 4 different payers that make up the initial 80% of market share kind of in New Jersey. So really, to get a full solution coming to the table with a school district, we've got to have kind of that more universal coverage and payers agreeing to kind of lock arms and go in and help kind of fund a cohort of students.
Yeah, and just one quick story on that, Amy. So we brought together a bunch of superintendents and health plan presidents, and the plan president said to the superintendents, he said, listen, we have all these services for kids and families. We often don't have their phone number. We don't know how to reach them. The school superintendent said, listen, we have the space. We know how to reach all of them. But you need to design your solutions to be able to be delivered in a school setting, and then we'll be the connective tissue between that. So I think there's so much opportunity if you bring those sectors together.
That all sounds really hopeful. I think that leads us to, what are you most excited about? I know that you've seen some really great outcomes in the work that you're doing already. So maybe we could each just take an opportunity to talk about what you're excited about. You kind of cover young lives in different ways. So do you want to go first, Duncan, and tell us what you're thinking?
Sure, and I've touched on a couple of these pieces. I'm really excited about kind of the funding innovations, and despite us, I think, raising the alarm bell, I am optimistic that kind of the system's going to catch up to the needs of districts. So commercial payers kind of jumping in on this. We didn't really talk about Medicaid. I think a lot of states have done some great things to expand the coverage of school-based Medicaid. In about 30 states, it's only for special education students, and in about 20 states, they've expanded it to general education students. Medicaid is still way too complex for most districts to implement, so especially small and medium-sized districts, they need a lot more kind of technical assistance. Also really excited about a lot of the subclinical programs and innovations that are taking place there, so coaching, peer support, some of the things that Gary mentioned, I think are really exciting as well.
Yeah, I'm excited that we're here. Thank you so much for just having the conversation, and I think that the collaboration between people doing this work, this is a big problem. And it's going to take all of us working together to solve it. So the cooperation and the standards, and just the willingness of schools to be open to innovation for that subclinical. I think that there's a place for people-powered technology to bridge the gap for those Tier 1 and Tier 2 students that is really just blossoming, and that's exciting.
I'm just excited about the innovation that's going on. I mean, I think every time I talk to the folks on this stage here, everybody that I've met here, it's really clear we are not waiting for someone else to fix this problem. We're out trying things. Some are going to work, some are not going to work, but thinking very out of the box. I think the one thing we all agree on is that the old way of doing things is not going to work for this next generation. It's very, very complex, and it's not like the old way was working anyway. So if the old way wasn't working, this is an opportunity to build something which is much more effective, and much more effective at scale for the next generation, our kids, our children, future generations, that are frankly going to bring better solutions to the table than we would even dream of ourselves.
I love all of that. What I would add is that what has been enlightening for me in this room is to hear almost every single speaker talk about prevention and talk about equity. And those two things actually mutually reinforce one another, by the way. This idea that we've been talking about mental health in terms of its relationship to clinical diagnoses mostly in this country, but what I hear in this room is us talking about a level of mental wellness that is divorced from a clinical diagnostic category, of a state of being where we're all healthy, happy, and thriving, where the goal isn't to resolve a crisis, but to help us live our full potential so that we can show up in classrooms, in corporations, in our families, in ways that really speak to who we want to be in the world. That's what young people deserve, and that's what I'm most excited about.
Yeah, no. And I'll just add, I get to, even though there's no young people in the room, I get to spend my day
Just on that, Patrick did tell me to bring all of our kids,
okay,
and that would have filled most of the spots, but I declined.
And so, and as a father of three, so I get to work with young people all day long. And I will say it is, as much as it's easy to be cynical, there's an amazing generation of kids that are vibrant, that are resilient, that actually, even though all the stigma data is real, we're actually not seeing it as much with our kids, that if you have services referred by someone that they trust, if they're going to see a provider that looks like them, that can speak to them in their native language, they actually will embrace care. And so I'm incredibly optimistic that a lot of things, at least that I feel like in my generation, are hang-ups, that a lot of their kids are much wiser and more thoughtful about this than I am.
I'm so excited. I think that you've really painted a beautiful picture of what our school systems could look like, what our communities could look like with this added layer of care, and I am hopeful. So thank you all for being here today.